Couche and good evening, everyone. This is John from Partners in Health, Sierra Leone. Today is Wednesday, April 15th. 2 new coronavirus cases were confirmed last night, bringing the total number of cases in the country up to 13. All patients are in stable condition at the military hospital. Today we're going to be joined by Isata Dumbuya in Kono, who is our Reproductive, Maternal, and Child Health Program Manager. Isata is going to be talking a little bit about the impact that coronavirus is having on maternal health services in Kono and some updates about the Maternal Center of Excellence planning. Also, just wanted to say thank you to everyone who's been listening to these updates. If you have ideas about future guests we can have on this update, please let me know. Send me an email, jlasher@pih.org, and we'll be happy to schedule those in the upcoming days and weeks ahead. I hope everyone's doing well. And now to Isata.
Hey.
Hey, Isata, how are you doing?
I'm all right, thanks. Okay. Hi, everybody. I'm Isata Dumbuya, and I'm the RMNCH lead for Partners in Health in Sierra Leone. I've been doing this job now since June 2018. I'm still loving every minute of it. It's challenging. It's exciting. No 2 days are the same. Some days you make more gains than losses, and other days nothing seems to go right. But every day I come into work determined to do the best that I can and to support the staff that I'm working with, both the PIH staff and the Ministry of Health staff, to also do the best that they can in terms of patient care, to give of their very best, and to just help the women and babies of Kono District to get the best and most positive pregnancy outcome that they can. And the care that we try to give is intended to not just save lives, but also to improve their whole reproductive journey, to just make it special and different from anything they've ever experienced before, to encourage them to come back.
Every time we speak, I'm reminded how lucky we are that you're part of our team now.
Thank you.
So what impacts has the coronavirus pandemic had on maternal health in Kono District at Wellbody Clinic and at Koidu Government Hospital?
Right. So like most of the departments in the hospital, we did see a reduction in the number of women that came in, both sort of for antenatal care, primarily for antenatal care, because I guess they're probably thinking, this is not an emergency, I'm well, and I would rather save myself a journey into the hospital. Because there was a lot of uncertainty and fear around coronavirus. So the messages that were going out there was, don't go to the hospital. Women who might want to come for antenatal checks were being told, don't come. What we also saw in the initial periods at least was that we had women that did come into the labor ward were usually ones that were much further along in their labor than we would like. So we didn't have a lot of time to monitor them. So if things went wrong, we didn't have the preparation time that we usually get to make sure that we can put interventions in place to have a better outcome. So they were coming in critical stages. They were coming in pretty late. They come in late most of the time, but this was just getting later, and there were fewer of them. So for the first couple of weeks, what we saw was that almost every woman that came in ended up with a cesarean section because her labor had progressed so far along and it wasn't positive. And these women were also, for the most part, referrals brought in from the PHU by the ambulance. So we saw a reduction in women who would actually voluntarily walk in. So if she came in, she was either referred from some other place, including from the antenatal clinic across the road, very rarely, or maybe she lives locally and she's been at home and the labor hasn't progressed as well as they would have wanted, so they've had no choice but to bring her into the hospital. Now it's beginning to improve. We started seeing more numbers come in. The antenatal clinics, especially at Wellbody, the numbers have started to increase. But yesterday was clinic day, and we had near enough the same amount of numbers. Look, you're scared. We're also scared. There's a lot of uncertainty around COVID, but these are the things that we do know. And these are the things, the measures that we do know that we can put in place to hopefully help prevent the spread. But what we don't want is you and your fear of COVID preventing you from coming into the hospital to access normal services that would improve your health outcome and prevent you from having other morbidities that have nothing to do with COVID. So your fear of COVID should not stop you from coming into the hospital and getting the treatment that you need and getting the care that you need. We're getting more women coming, relatives that coming into the hospital they seem happier about staying over the 3-day lockdown. Maternity probably had the most non-inpatient people in and around there, because almost everybody that came with their relatives had to end up staying in as well. But we made it as good as we could possibly make it for them, and just had them try to understand what is COVID. So that was a great teaching opportunity for us as well. And by the time they left, hopefully they took the right message around and are spreading that within their communities as well.
And have you been, I know previously before coronavirus, you were going out to the different chiefdoms around Kono district to educate community leaders and families about the services that are available at KGH and at Wellbody Clinic. Have you been doing any outreach since the coronavirus epidemic started? And if so, what have you been sharing?
Yeah, so I was really lucky to be part of the CPH program, to go out there and to talk to people when they were doing all the engagements with the community health workers and some other members of the clinical team. So I was able to go to 4 chiefdoms, which was really good. I mean, partly because I'd been there before, but it was great that you could see some of the same people that we talked to before, and just explaining to them step by step what is coronavirus, what is the impact that it's having all over the world. So just for them to understand that we're not alone in this, and what other people have been going through, and how we are preparing and doing everything we can to try and minimize the risk and the potential for us experiencing the same level of infections and deaths that other countries have been doing, and also just trying to get people to understand that the hospital is still open, the PHUs are still open, we're still working as usual, we're still open for business, and we want your women, your children, the adults all over, sick people, please come to the hospital, come for your checks as usual. We will isolate you, we would test you, and we will treat you if necessary. Yes, people are dying from this disease, but there are a lot more people that are surviving than are dying. So just having that interaction, it allayed a lot of the people's fears. I mean, it was the stakeholders that were there, the handouts that we took, they were able to look through them. It generated a lot of questions. They seemed to understand a lot more about COVID by the time we were done, and were willing to take the message forward and say that right now we know we are also less fearful, and we will let our people know and encourage them to say you have to come to the hospital.
Kono district in Sierra Leone as a country has a lot of experience with fighting an outbreak because of the Ebola outbreak. And so communities in and around Kono district and the country as a whole are better informed about how to prevent the spread of an infectious disease than many communities in America or the United Kingdom.
Yep. This is so true, because even when we started talking and relating back to Ebola, and you remember what it was like. You remember what you guys went through. You remember what you did to be able to arrest it, and all the things, all the measures that were put in place. So let's just go back to that way of thinking. Let's just go back to that way of behavior. Let's just do our social distancing again, putting all those measures back in place. I went with a CHO, different CHO each day, and each one of these guys had actually worked within the chiefdom that we went to during Ebola time. So they remembered these CHOs and they were able to relate to that, and they brought it back home to them to say, right, we just have to put that hat back on again and think that together we can help to make this situation better for ourselves. But we all have to work at this together, and everybody has to do their own part. A couple of weeks ago, even before we had the lockdown, there was a marked reduction. You would come into Koidu Government Hospital, and there's usually a crowd of people out by the triage area. There's a crowd of people by the outpatients. Some are patients, some are waiting, some of our company patients. That stopped. Patients were still, the few that had to come in were the ones that had no choice. And when they came in with one person. Usually the average rate of accompaniment is 3 people per patient. They were coming in with one person at a time. And they were trying to get out as soon as they possibly could. It's getting better. We're almost back to normal. So it's good to see that they're willing to come back. I mean, we still have to try and get the message across about still social distancing and not coming around to the hospital area if you don't need to. But at least the patients are walking back in and are seeking care, which is one of the things that we've heard the most, that one of the fallout of this, people are not going to come to the hospital. And when they do come, they're going to be critically sick, and we're going to have more and more poor outcomes.
Yeah, and that was the same during Ebola, too. Most people in Sierra Leone never had Ebola, but were dying from lack of access to clinical care for things like malaria and tuberculosis and HIV and car accidents and all the things that were affecting people even before Ebola in this country. If you have information on that, is there any special training for RMNC? I never can get the acronym right. Reproductive, Maternal, and Child.
I'm like, there's too many letters in this.
Are there any special trainings for reproductive?
Every time I'm like, someone's going to ask me, what do you do? I'm like, oh, no, not this. I always trip myself up.
That's why I had you introduce yourself at the beginning, because I can never remember all the
I'm going to think up a new title and let you all know, like, yeah, I think this is what I want to be called now.
Maternal Health Czar, I'll call you that.
Yeah, right. So in terms of training, what we've done with the maternity staff, they've been a part of the core hospital training. But more and more now with regards to prevention and what we are doing as the clinical team and working, what we've done is devise something that goes hand in hand with the triage system, because like almost everywhere, when people see a pregnant woman, even if she got a broken toe, she had to go to maternity. That's where they deal with pregnant women. So it's trying to get them to understand that at the triage, this is the first point of entrance. You need to screen everyone. Whether she's pregnant or not, you would still need to automatically, if she has the symptoms, then don't send her to maternity. Screen her and go through the normal procedure, which is we start thinking about, we need to get this patient isolated. We need to call in the assessment team so they can check, move the patient to the isolation ward, and we would rather see a pregnant woman with symptoms in isolation so that we reduce the risk of spreading to the other patients that are within the unit. So it was more about reassuring the staff to say that these are the symptoms. This is what you're looking for.
Sierra Leone has the highest maternal mortality rate in the world. Our plans and strategies to radically reduce maternal mortality include expanding Koidu Government Hospital's campus and building a Maternal Center of Excellence. And I know there are many people around the United States and the world who have contributed to helping us realize that vision of the Maternal Center of Excellence. What would you say to those supporters who may be worried about COVID-19 and its impact on maternal health in Sierra Leone and how this is impacting planning and execution of the Maternal Center of Excellence?
Right. First off, I'd like to say a huge thank you to everyone who has contributed in whatever way to making the dream becoming a gradual reality for us to build a Maternal Center of Excellence in Kono. This is something that is much needed. Our maternity system at the moment works. It works well, but it's already overused. There's a lot of things that we know we could do better, given the space, given the equipment, given all the extra staff. So we're doing the best we can now, but we know that we have bigger and better things to do. And being able to build that maternity center of excellence it's beyond anything any of us could ever imagine, and a proper dream come true. This is not something we've been working on this for almost 4 years now. And every day we make closer and closer strides towards the reality of this happening. Even now with COVID, yes, this is the foremost thing, not just in Sierra Leone, in Kono, in the whole world at the moment. So it's a reality that we all have to find a way to deal with. But there will be life after COVID. The maternal mortality in Sierra Leone still continues to deteriorate despite COVID, and until we get more and more structured systems in place, like the Center of Excellence, it will still continue to deteriorate. What we're doing is we're still pushing forward with our plan for making the Maternal Center of Excellence become a reality. We're still realigning our plans. We're checking to make sure that everything, and in fact, with COVID, we're getting more and more ideas about things that we perhaps hadn't thought about or hadn't put very high on the list of agenda priorities in terms of the planning. We're now having to move forward with those. So we're thinking about, right, we need more isolation units. We need more staff trained in high dependency care. We're going to need more equipment so that if in the future, whether it's COVID or anything similar, that you know that you need more critical care intervention for pregnant women, we need to build that in there. We're having our weekly meetings about what else we need to think about in terms of this, and sharing it with the staff, getting the staff on. Everyone is still super excited, enthused, and sold into the idea of Maternal Center of Excellence. COVID has raised our awareness to the fact that should it come here, our pregnant women and our babies would be particularly vulnerable and at risk. So even more reason for us to keep on planning how to reduce that risk to them, and how, with our Center of Excellence, entering factors that will make sure that we can deal with any future outbreak or any future incidences that will have an equally negative impact on maternal health.
Yeah. And, emergencies have a way of commanding our attention. Maternal mortality in Sierra Leone has been an emergency for decades for women and children in this country. And so, reminders that the work of health system strengthening, the work you're doing every day to improve systems for maternity care in the epicenter of maternal death, that is an emergency response that we're doing.
Yeah.
And so I think you put it beautifully, that the work is continuing and that it never was put on pause. What are some of the standout improvements you've seen in the maternity wards and in reproductive and maternal and child health care in Kono since you arrived? And what's keeping you motivated and energized during this moment?
Oh gosh, there's so much, John. I remember when I first started here in like a long time ago now, 2018, and the difference from then to now, first off with the staff motivation. Staff, and we've had a few additional new staff, but most of them were the same ones that I've met there when I first started. They now come to work because they really want to. They come in determined to do a great job. They come in also determined to enjoy doing their job. This week, we're doing a week's training because we're opening up a high dependency unit in maternity. This is also something new. We are able to look after critically ill women in a dedicated place with staff that are now happy to come to the training. So it's just when the staff, the level of motivation, the pride that they take in their work, the interest that they take in. A woman should not die in pregnancy. She should not die when she comes to give birth. This is not something that we should just take lightly anymore. This is something that we should fight to prevent. And this is something that we should do everything with the resources that we have, with the knowledge that we have, with the finances that we have, to try and prevent it from happening.
Yeah, I mean, that transformation of going from having no resources and not being able to intervene to save a woman's life that would otherwise live if they were living in London or New York. And now to have resources available in training and supplies and electricity and a blood bank. Well, Isata, thank you so much for taking time. You're a hero. And I'm sure we'll talk again throughout the COVID response and maybe some additional updates on the general maternal health program.
Okay, Joe, thanks very much. Great talking to you too.
Take
it easy.
Tomorrow we'll be back with some mental health tips, how to stay resilient during the coronavirus epidemic. We'll be talking to Mawuena, who leads the mental health program at PIH Sierra Leone. Hope everyone's having a great week, and we'll be back with you tomorrow.